Hair loss can't always be prevented and can be caused by either genetics or environmental.
Hey viewers, welcome to Sky Mitzvah. This is Dr. Venu Jairam. Today our main topic of interest will be PRP. Blood has many components in it, RBCs, WBCs and thrombocytes or platelets. Apart from this, there are other components in the blood. Today we are going to separate platelet-rich plasma from the blood, where the plasma chiefly consists of platelets. Types of PRP. There are three types of PRP. One is a regular PRP, the second one is the activated PRP, the third one is the bio-PRP. The regular PRP, we inject the plasma and the platelets into the scalp. The activated PRP, we introduce activated compounds to the platelets which help in releasing the growth factors. The third one is a bio-PRP, where biotin is mixed with the platelet activators and then injected into the scalp.
First of all, you need to understand how PRP is extracted. 16 ml of blood is extracted with anticoagulants in a vial, so that blood does not clot after it is placed in the centrifugal machine. Now, centrifugal forces acts on it. Here in PRP, what is very important is that the whole process should be done very quickly. That is, blood is extracted, centrifuged, after that plasma is extracted and injected. All of this should be done in 45 to 60 minutes. It cannot take longer because if too much time is wasted in this process, then the platelets will start separating in the tube. PRP thus extracted is injected into the scalp via 1 ml insulin syringes on areas of thinning.
Our second topic of interest is GFC. GFC is a second generation product. GFC is nothing but an advanced form of PRP. GFC is more stable at room temperature when in comparison with your PRPs. And since GFC is an acellular treatment, it's less painful and less inflammation is seen in the clients as in comparison to your PRP treatments.
In GFC, we collect about 20 to 30 ml of blood. The extracted blood is introduced into an advanced tube, after which you have to shake it 6 to 8 times by inverting it upside down, and then you have to keep it upright for about 30 minutes in room temperature. After resting the tube, place the tube in a centrifugal machine. Centrifuge it at a speed of 3400 rpm for about 10 minutes. GFC is an acellular treatment which does not have any RBCs or WBCs but has only growth factors from platelets and neoplasma, so the chances of pain and inflammation is very less. Indications of GFC and PRP would be androgenetic alopecia, alopecia areata, skin rejuvenation, contour defects, acne, and wound ulcers.
Who are eligible for this GFC and the PRP treatment? Generally, people with diffuse hair loss or diffuse thinning of hair, the condition is called as telogen effluvium. In such condition, the prognosis for the treatment with the GFC or the bio-PRP is really effective. The prognosis is very good in such conditions.